I was at a St. Patty's Day dance, enjoying myself with my wife, having a great evening. It was 2 years ago, and I came off the dance and I was walking and I tripped on the edge of a chair, and I fell on my left side, and I think I spoiled the party. The femur separated from my hip, and so they called an ambulance and they took me to a local hospital, and I had to have a hip replacement. 5 weeks later, I had a sharp pain in my left thigh that felt like a knife was going through it, and my whole incision was inflamed. It was blown up, basically.
Unfortunately, bacteria now are very smart and they attach themselves to prostheses such as hip and knee replacements. And unfortunately, just giving antibiotics doesn't solve the problem. In many cases, we actually have to take out the prosthesis temporarily.
And so they opened it up and they put a cement ball in it called a spacer, and they filled it with antibiotics.
You can see here, this is this left hip, and this is a hip spacer that's made of cement.
The purpose of that was to kill the staph infection.
A staph infection is basically an infection where bacteria on the skin can penetrate and get deep into the tissues.
My oldest son, Paul Dlug, did some research, and he said, "Dad, you're not going to go to the local hospital." He said, "You're going to go to hospital special surgery," and he checked on Dr. Westrich, who does reconstructive surgery, that he takes out the spacer and he puts the proper prosthesis in.
This is a hip prosthesis that's been put in. This shows this hip replacement, and it's in excellent position, and there's no evidence of any recurrent infection. Some of the things that we do at Hospital for Special Surgery to prevent infection are very unique. We have specially designed operating rooms with laminar airflow, where the air comes in from the ceiling and goes in a straight line down and prevents the cross side-to-side airflow that can have a lot of the bacteria and cause infection. The second thing that we do is we operate in what's like a spacesuit, where our own breathing and bacteria is prevented from going to the patient and to the surgical field. And so not just the surgeon, but everybody in the operating room field will actually use one of these spacesuit-like devices to prevent infection for the patient.
By going to hospital special surgery, I am in better physical shape than I was before my fall.
Once he had the reimplantation surgery, and then he had appropriate physical therapy, he's actually lost 25 pounds, and he told me that he's actually doing better today than he did before he broke his hip.
I had the operation the day before my birthday. They made it a joyous event for me.
One of the things that I think Mr. Dlug's case demonstrates is that it is worth the trip to come to Hospital for Special Surgery, and I constantly hear patients that will come in and see me that have a complication such as an infection or something else, and they'll say, if I only had known about Hospital for Special Surgery before my problem, I would have come to the hospital first. And truly, once patients learn about orthopedic specialty hospitals and understand that the risk of complications is lower when patients go to an orthopedic specialty hospital, then it'll make it worth the trip to come into Manhattan to see our specialists.